Hi, I'm Thomas, the CNA Ninja. I'm here to show you guys how to make your job a little bit more easier and how to deal with different circumstances with your patients and with your nurse and uh, how to deal with family members and make your job just a little bit more easier so that you guys can get the job done and make sure that the family members are happy. Because if you have a happy family member, you do have a happy patient and a happy nurse, a happy CNA, happy doctor. Um, First of all, I just want to make sure that I have 19 years of experience as a CNA and a whole bunch of years in life. So with that being said, I'm going to go over just a couple of experiences that I've had dealing with family members and different circumstances. Um, if you can get along with the family member as to like, then you can get along. They'll like you. You'll be able to get along with the patient, and you'll see a whole bunch of differences between you and the patient and their loved one, you and their loved one, and to make sure that you guys are everybody's on the same page. Uh, you know that if you know what time the patient's family member's coming, try to make sure that the patient is nice and clean, the room's clean. Pick up towels and stuff like that. The first impression that they get is always the first impression is what they remember the most, no matter what after that. They'll just remember, hey, there was towels on the floor, or hey, it was beautiful, it looked nice, everything was clean, and everything was done. Um, Make sure that when you get a new patient, that you present yourself to them. So, hello, my name is Thomas CNA, and I'm here to help you. You're here for whatever reason they're here for, and for therapy, and that we're going to help you reach your goals and help you get better, and just an overall good environment for you here. And they're this is their first time here or at the place where they're going to. So try to make it as comfortable as possible. Like, make sure you bring them ice water and a little kit of toothpaste, toothbrush, and stuff like that. And just be real presentable, laugh, and if they're in a lot of pain, just say I'm sorry, and let them know that the nurse is going to be with them right away, and that she'll figure out their medication, and that they will get the medication as soon as possible. Another thing is, you want to make sure that you clarify if they're going to do the laundry or if you're going to do the laundry at your facility. That way you can mark it on the sheet. Make sure you mark all their belongings on the intake sheet, because you know that if something's missed on that paper and it comes up missing later, you're going to be able to, it's not on the paper. If it's not on the paper, they never had it. So make sure that you put any valuables on there. Or what I do, if I see a lot of watches, a lot of stuff, money or stuff, I ask the loved one if they could please take it home. If not, then we have to put it in the vault. And man, I'd rather them take it home, because then there's more paperwork. And just while they're there, just kind of come in and out and just ask them if they're doing okay. You're gonna have to get their weight, their vitals, their height, and if there's any oddities in any of the vitals, of course, let the nurse know. And also, you know, uh, just let the loved ones know that they're going to be well taken care of, and that you're here to help them, and just keep telling them that it's going to be all right. They're upset too, because depending on what trauma happened to their loved one, I mean, they may have a broken hip because they fell. I've had them where they were laying on the floor for 3 or 4 days, and that part of their face is because it was on the floor, so against pressure. So of course that part of the skin started to die. So you'll have different situations that come into where you work at, depending on if you're at a hospital or a rehab. Um, Another thing is just make sure that the resident know that they're probably not going to get seen by therapy that day. That they'll probably be seen by them on Monday or the next day if it's a weekday, and that they'll be able to tell you and the patient, what they can and cannot do or capable of doing. And also just make sure you put all their belongings and stuff away so that it looks nice. Put they're gonna have a closet and where you can dress your drawer where you can put their stuff in. And I always put it in that day. That way, the loved ones know and say, "Oh, look, he's putting it away," so that they care here. Um, Also, just let the nurse right away know that they're ready, after you do your thing, and that way she can get in there and get their medication and get them all set up. And make sure they have the call light, and, tell them what the call light's for. You push the button, the call light goes on outside, I answer it. I should answer it within 10 minutes. If not, I'm in another room and I'll get to you as soon as possible. Also, after you do the inventory and all that stuff, the patient might be hungry. You might want to ask them, "Hey, would you like a snack or something?" Or if dinner's coming, just let them know that dinner will be showing up in a few minutes. So I don't want to ruin your dinner, so I bring you a snack. With that being said, thanks a lot for joining me on this video, and hopefully we'll touch base, and please like and share the video. Thank you very much for your help and understanding and listening to me. Thank you.